there's parents' fears and there's kids' fears. The kid's biggest fear is, am I going to need to wear a brace? It's really interesting. I have had young women literally look me in the eye and say, I would rather have surgery than have to wear a brace. And so that's hard for me because obviously, despite the fact that I know that I can help kids a lot with surgery, it is always a last resort. I do everything I can to try to make sure that the kids don't need surgery. And so for them, the fear is, well, is this brace going to ruin my life, basically? And that's, I think, a really important thing to get across to them, and that helps. I think the important things for them to know are that despite having to wear a brace, if the curve gets big enough they need it, I absolutely mandate that a brace never stops any of my patients from participating or doing anything they want to do. If there is something they want to do, horseback riding, cheerleading, football, like I mentioned, that they can't do in the brace, they take the brace off for it, and they do whatever it is they want to do. And then they wear the brace the rest of the time. They take it off to go swimming in the summer. They take it off pretty much for whatever they need to take it off for. And so for the patients, really the brace tends to be the biggest worry. Some of the parents do empathize with their kid's emotional fear of the brace. But then they come around when we have the discussion about really wearing the brace is how we try to make sure your child won't need surgery. And so that's usually pretty straightforward for them to get there. The parents' fears really relate more to long-term function, long-term impact of the children. And that's the way we alleviate that is by also helping them to realize that we have come a really long way in the treatment of scoliosis. Whereas years ago, and even there are some places that don't have the advanced techniques we have here, that still do have people laying down and bed rest and bracing and things like that. For the vast majority of my post-operative patients, I literally tell them they can do pretty much anything they want to do short of contact football the day after surgery. They can get up and they can start running and going. And so there's usually somewhat of a sigh of relief there from the folks. And then they worry a lot about the complications of surgery. And the really good news is, for the straightforward idiopathic scoliosis that is the vast majority of our patients, we really are very successful with surgery here. Very, very low complication rate. And so that also helps alleviate a lot of their fears. And to let them know that in the long run, their children, their kids now, but to be adults, are going to live happy, healthy, normal lives and have jobs and families and go to college despite having had a spinal fusion.